So in terms of my training and experience, I went to school in Surrey, went to university at the University of London. My ophthalmic training was all in the south of England, initially in the Wessex Deanery and then in the South Thames Deanery. I finished my ophthalmic training and performed a corneal surgery fellowship at the Moorfields Outreach Centre at St George's Hospital. Once that had been completed, I undertook a further fellowship in medical ophthalmology and neuro-ophthalmology, so that relates to conditions such as uveitis and the links between the eye and the brain. That was at St Thomas's Hospital and King's College Hospital in London. After I finished my year of refractive surgical fellowship training in the island of Crete, I came to the UK once again to take up my post as a cornea and cataract surgeon in South Wales in 2006. So I've been developing corneal services and cataract services since that time. I was appointed as a visiting professor of cornea, cataract and refractive surgery at the University of South Wales just over 2 years ago now, and I continue with my clinical research and training alongside of my clinical practice. The volumes of cataract surgery that we perform across NHS and private is really substantial, and I'm very pleased to take referrals from colleagues both in my NHS practice and my private practice for patients who have more complex and challenging cataract cases, and for those who have corneal problems that make the planning of surgery, particularly with relation to toric lens implants, more challenging. I've been in the field of ophthalmology since 1997 and have enjoyed every minute of it, without exception. I took my consultant post in 2006 as a corneal transplant surgeon and cataract surgeon, have been developing services since that time. I've performed thousands upon thousands of procedures for cataract patients, including complex cataract surgery, and taken referrals from colleagues. I'm also a visiting professor of cornea, cataract and refractive surgery at the University of South Wales, which is a position I'm very proud to hold. I am very heavily involved in the training of junior doctors, and in particular training doctors to really think thoroughly and plan their cataract surgical procedures so that the best outcomes are achieved for patients. I'm training junior doctors to use toric lenses, and so really to think very carefully about preoperative astigmatism and improving the visual outcomes for patients. And one of the parts of my role, both in the NHS and my private practice, that I really enjoy a great deal is taking referrals for complex and challenging cataract patients, discussing with them and their families the particular aspects of their care that are challenging, how we plan to overcome those, and then implementing the plan of management in order to achieve the best outcomes for those patients. I invite you to book a consultation in order to determine your suitability for refractive cataract surgery or refractive lens exchange. It's the only way to determine your suitability for these procedures and to have an in-depth discussion regarding the risks and benefits of each of them. I look forward to seeing you there and taking you through the journey to achieving your desired post-operative outcome.